Yeah, thank you so much. I was just looking, it is so incredible to me that there are 93 people joining us here today. That's amazing. I don't know that we could have fit all 93 of those people in a session if we were live and in person. So, very, very exciting just to have this opportunity, though not typical for us. I love the way we're able to engage with so many people. So, good afternoon. Thank you for attending today's session on the effects of COVID-19 on online gambling in adults. I know I personally am very, very eager to hear everything Olu has to say about this presentation today. My name is Beth Burson, as Derek mentioned, and I'm here on behalf of Ohio for Responsible Gambling. I work for Origo Branding Company as a media buyer and planner, and many of you may have worked with me to customize or co-brand some materials for our statewide responsible gambling campaign, Get Set For You Bet, or our adult to youth influencer campaign, Change the Game Ohio. Both of these campaigns were created with the intention to help educate and raise awareness around problem gambling in Ohio for at risk populations and influencers who can help create positive change in their communities. We have campaign assets that target everyone from youth to minority populations to seniors to sports bettors. And our goal is really to help provide those tools and materials to community partners like you to use within your region, helping to spread the message about prevention and problem gambling. Accessing these materials is literally as easy as visiting the beforeyoubet.org website and clicking on the community toolkit. I am always happy to help when it comes to locating specific assets or helping you talk through a specific media strategy that you're kind of looking to, um, you know, customize specifically for your area. It's literally as simple as emailing me at beth@origobranding.com. I look forward to connecting with each of you at some point if we haven't already. Being that it is Problem Gambling Awareness Month, there have been quite a few of you that have reached out to me, and also quite a few of you that have said, "Hey, I saw you introduce that session. It's nice to put a face with a name." So, thank you for reaching out. And I hope that many of you that I've interacted with are on this session today. It's always good to get to just say hello and share great content. Now, I would like to introduce our speaker for today, Olu, who is going to share with you the effects of COVID-19 on online gambling in adults.
Oh, great. Thank you. That was simple. Great job, Derek. I mean, you gave that speech like I guess you've been doing it every day for the past 3 weeks. So uh, great job. Well, it's nice to be here. I'm, proud to be doing this all the way from Nigeria, but as a representative of the Council on Compulsive Gambling of New Jersey, as their public health specialist. And today I'm going to be talking about a survey that I was interested in doing once COVID started, and then relate that to what the dangers of internet gambling are, how internet gambling affects mental health, but something that might be unique that you may not really have heard, at least I hope, in a lot of these presentations will be the role of advertisements on internet gambling, the online strategies we propose or research has proposed to reduce the harms that we are seeing with internet gambling, and lastly, a public health approach to addressing gambling-related harm. And so my question, what I was trying to find out was, is there an uptick in online gambling due to COVID-19? We assumed there was conversation around it in the news and all of that. And it just seemed to make sense. People were out of the casinos and they needed to find an outlet to do it. But more importantly, were there going to be new people or people who had never gambled before who would then take on this activity because they needed something to do? There was only so much news around COVID one was willing to listen to. And, being cooped up at home, people were going to, need some kind of an outlet. And, initially you couldn't even go to the stores to get alcohol. So the immediate thought was, it would drive up online gambling. And so I was curious to know if this was indeed the case. And so this is a very small sample. It's just a convenient sample of about 47 participants from our list of, and we, put it out on our website and on LinkedIn. And we asked them to take this very short survey. It was just 10 questions. And, just to give us enough insight to be able to say that there is something here. So, of course, our hope is that one is able to replicate this kind of information, nationally, statewide, because it would help us to understand where maybe we're able to better put our resources. So, like I said, the survey looked at if they've ever gambled online prior to COVID-19, their level of participation since COVID-19, the amount of gambling activities since COVID-19. And, I also wanted to know how many people created new online betting accounts during COVID-19, and then the views on their gambling related problems since then. Of course, we also got some demographic information. And so, again, a small sample, but I think it brought up some interesting insights. So, for example, 34% of the population had gambled online prior to COVID-19. 34%. And then there were 11% of the population who were first-time online gamblers. It might seem small, but again, if you just looked at 11 out of 47, or just even think about 11% out of 11% out of, off of the nation, that's still millions of people that are affected. And that's still a huge number of people that then are potentially able to, get addicted to gambling. And so that was a total of 21 people. So about half of a little just under half of our population, for a total of 45%. And so then the next question was, how many people, or what did they believe their participation in gambling activities were pre-COVID versus during COVID? And 52.4% believe that their gambling was somewhat more or much more than prior to COVID-19. So I've added the numbers up here as, to give you a more robust information to say that a lot of 52.4% of them were worried that, or at least indicated that they were gambling same, somewhat more, or much more than prior to COVID-19. Then I was curious, like I said, about how many people had created new online betting accounts since COVID-19, and 57% of people had created new betting accounts. That's a huge number of people, and an important thing to kind of keep in mind, given that, like I said, these were people who maybe would never have gambled prior, or maybe they gambled in the casinos and then had to resort to this medium. And then we wanted to look at how much time they spent gambling pre-COVID versus during COVID, and 67% of them felt that they were gambling much more or somewhat more. So this is the 62% here you see, and the 5%, right? So 67% of them indicated that they were spending more time gambling during COVID than prior to COVID. So again, just think about what this means literally. Someone might go to the casino for 1 hour and need to go back home because they have other responsibilities. But you're home now with, with COVID, and so you can spend hours. I mean, I could be literally betting as I'm talking to you right now. That's how interesting this medium of being able to do this online, the access that it gives to people. And so I also wanted to know how they felt, what their own perception was around some kind of a gambling problem. And so 24% were concerned that they were developing a gambling addiction. So again, this is just some self-awareness of the fact that they realized that they were spending a lot of time and they were spending a lot of money gambling. 52% were concerned that they were spending much more money than they could afford on online betting. Again, self-awareness is, key to understanding and being able to then hopefully correct. So the fact that they could even answer this question honestly was an important insight. And just going real quick through the age groups, 29% were 18 to 34, which is a big deal. As far as gender goes, it was evenly split, pretty much 48%, 47% male and female, and 5% was transgender. And as far as race ethnicity, it was the breakdown: 71% were Caucasian, 19% Black, African American, and 10% indicated that they were Asian or Pacific Islander. Now, I've just told you a bunch of numbers, but what does that really mean? Why do these findings matter? The first thing to point out is to go back to demographic information. There's a reason why we kind of always want to know, okay, yes, this thing is affecting people, but who's it really affecting? It was, like I said, almost even split between male and female, and a significant number, which is, like I said, 29%, 28.5 of young adults aged 18 to 34. So these findings therefore highlight a problematic relationship between online gambling and the possibility of developing a gambling addiction and going into debt for both male and female in young adults, right? So if I am just to go back, if I looked at the numbers, 29%, I believe, were 18 to 34, 33% were 35 to 50, 35 to 44. That's a huge amount of people. So again, over, trying to do the math here, over 62, about 62 of the population in what we will call a young adult age group. And so if they're the ones being most affected and most able to or engaging, I should say, engaging in online gambling, then there's a risk of them becoming problem gamblers, developing a gambling addiction. And this could very well be problematic for those of us in prevention work and for us as we continue to hopefully stem this disease. And so in particular, of the 5 people who gambled online for the first time, so the 11%, 2 were concerned that they were developing a gambling addiction, while 2 were concerned that they were spending too much money that they can afford on online betting. So again, 4 of the 5 of those individuals, of the 11% of people who were gambling for the first time, who created new betting accounts for the first time, and not just gambling. Again, we can assume that maybe they had gambled once, twice in the casino, maybe they had not, but now they were gambling online. And I'm trying to say that because our topic here is internet online gambling, right? 4 of those 5 people were concerned around a gambling problem, whether it was getting into debt or they were developing a gambling addiction. That is a huge amount of people. And so, assuming that these 5 participants had only ever begun gambling since the start of COVID-19, that is March of 2020, then it implies that they had developed these problems quickly within 6 months or less, as the survey was conducted from October 1st to October 31st of 2020. Again, this is probably, if we were doing some kind of empirical science research, it might not exactly hold to water, but it's a good assumption given their responses. This was self-reported, right? It's not only a good assumption, it's a good indication of how possibly quickly it is that gambling problems can be for people, because it's oftentimes considered something that maybe takes time. It's oftentimes also very hidden. So one may not realize this until they've probably gotten worse off. And so maybe for these people who took the survey, the fact that they were able to do it on time, maybe it would be an indicator to realize those problems. But whatever the case is, it gives us some kind of information around prevention work as to how soon one should start to give this information. Of course, we understand primary, secondary, tertiary prevention. So this would fall, in my opinion, under some kind of tertiary prevention. They've already started doing it. Or maybe even secondary, they've already started doing this, but we want to help them quickly not get to the part where it's become a significant problem. And so, time for a poll question, right, Corey?
Yep, I went ahead and launched the poll question.
Okay. And so I'll just read the question. Does non-internet gambling, so casino, lottery, bingo, EDC, cause more harm than internet gambling? I want to know what people think. And I feel like you guys may already know because you heard Dan speak earlier.
We've had about half the people have engaged with the poll so far.
Okay.
Let me know whenever you want me to end it and I'll share the results.
I'll give them one more minute because this is helpful for their CEU. So we can do one more minute. Oh, wow, time is gone. Okay. I think we can end it now. I didn't realize time was going. 64% of people think, wait, let me make sure I'm reading that correctly. 64% of people think that non-internet gambling doesn't cause more harm than internet gambling. I'm so lost as to how I did that. 11% said yes. Okay, I got it. 11% believe that non-internet gambling causes more harm than internet gambling. 64% of people don't think so. All right, so we're going to talk about what is internet gambling and the harms. And I'm just seeing a chat, so I want to make sure that. Oh, okay. All right. So we're good. Okay, so so let me tell you what internet gambling is before I answer that question. Internet gambling refers to the range of wagering. Internet gambling refers to the range of wagering and gaming activities offered through internet-enabled devices, including computers, mobile and smartphones, tablets, digital television, or whatever, just as long as you have access to it on something that is instant, for lack of a better term. And research suggests that people who gamble online do so because it's convenient and constantly available. I can do it in the bathroom. I can do it anywhere I want. Some people believe it has greater value for money, maybe because, again, they're not spending money having to buy a drink at the casino or go to the casino and get parking and all of that stuff, right? So it has greater value for money. There's greater variety of games. I mean, it can be anything from some sports betting activities to, anything really, whatever. It can even be in word games for some people where they're able to engage in this kind of internet gambling because there is some kind of reward associated with it. And of course, the biggest thing, as one can assume, is anonymity, right? And there's the ability to play for uninterrupted periods. There's the reduced stigma, right? If you are someone who maybe your family members have a history of gambling problems, for example, and you don't want to be seen as one who's continuing to do this, you might be, more willing and able to do this online where nobody can see what you're doing, nobody's able to track what you're doing. And so, of course, there's that increased feeling of comfort, is less inhibiting. I don't have to dress up to go anywhere. Like I said, I can be in the bathroom. There's greater sense of perceived control. Again, this is probably all through every kind of gambling anyways, but I think there's something around the idea that you are making some kind of informed decision that maybe might not be controlled by the casino owners because maybe they can control the lever. And so that's why you can't win in slot machines the same way you can play a slot machine game online, but somehow you feel like you have some perceived control around this much more than if you did it in the casino. And then again, it reduces the social barriers to engaging in gambling. Think about it for, again, like I said, the young adults, and this is probably also pertinent to those who are younger than 18, who might be able to bypass all of the restrictions online than they would be able to do in a regular casino. And so when we say online gambling, internet gambling, the suggestion is then that there is a specific internet gambling disorder. So not just gambling in of itself as the umbrella, but for those people who do it online, there's a little difference. And you've heard this also being used around internet gaming as well. The regulators, and I'm drawing a blank now, are trying to decide as to, oh yeah, DSM-5. They're trying to decide as to how they would differentiate between internet gambling and physical gambling disorder. And maybe they will, maybe they won't. But what we are seeing as far as researchers, what we are seeing as far as the differences is what we are saying here, which is one, individuals are more likely to be male. Well, as you saw, with COVID-19 being the only method, with online gambling being the only method to gamble during COVID-19, we saw that a lot of females were participating. It was pretty much the same. And so some of these definitions are probably going to change prior to now, beyond COVID-19, which is again why this is important to point out now and to understand how has COVID-19 affected all our lives in many different ways. And so, this definition may change as far as who is more likely to participate in internet gambling. Young people, I mean, the data actually confirmed that with the little analysis, we ran at the council. Young people ages 18 to 30, which is a little different from the physical location. Yes, it's younger people, but the start age, right? Especially when some of the casinos, you can't go in until you're 21 and things like that. And so there's a little bit of change there. More people are likely to be single who participate in internet gambling disorder. Not really sure why that, but that's something that researchers have been able to point out. Researchers have also been able to point out that more people who do internet gambling disorder are more likely to be educated and employed. And I think that makes sense in some ways, right? The idea that, one, you have to have access to internet, right? You have to have access to a way to fund your accounts, stream seamlessly online and things like that. So that's another thought. Internet gambling disorders is more likely to be in individuals who are frequent gamblers and engage in a greater number of gambling activities, even including land-based games. So our belief is that people who play at the casinos and lottery and all of that are also engaging in internet gambling, the point being that they want to do it all. They just want that activity. And so any way that they can do it, if they're not able to get to a physical location, they can do it online. We also believe they're in higher debt. Again, just the association around the fact that they are more likely to be educated and employed. Lower prevalence of tobacco, alcohol, and substance use. And if you notice, there are some asterisks behind some things here. These are those areas where we still need to do more testing, more surveillance to understand. Is it really because they don't have access to alcohol and tobacco use? Is it because, what is the reason? Why is that possible? Is it the idea that in a land-based game you're probably more relaxed, you're participating in something where you're waiting for, say the the server to play the card, or everybody to play the card, and so you're not using your hands as much as if you're doing it online, where you kind of have to be using your hands, things like that. We still need to find out more, but we do believe that they engage in co-occurring risky behaviors much more, and we are beginning to see that they're reporting more health, psychological, and problems gambling. Again, some of those things are not necessarily clear, but it makes sense. You're seated all day. You don't need a lot of activity as much, and you're constantly doing it. And so I can see, we can see how it affects their health more. And they're less likely to recognize their problems or seek treatment. Again, it's almost kind of what a lot of us do, even with social media, but then even worse, because we don't realize how much time we're spending, how much activity we're doing with some of these online use. And so I'm going to show a video real quick. I hope it plays. It's a very short video, and I just wanted you to hear it from someone else other than me.
American Psychiatric Association guidelines for diagnosing a gambling addiction doesn't distinguish between placing bets in a physical location, like a casino or racetrack, and over the internet. However, aspects of online gambling make it potentially more addictive and harder to recover from. For example, online gambling is available 24/7 via computer or mobile device, anywhere there's an internet connection. Internet anonymity makes it easier to avoid traditional barriers to participation. This has resulted in a new generation of problem gamblers, teens and young adults, particularly young men. In private, players can easily consume drugs or excessive alcohol, which can increase the amount of time spent gambling and money wagered. Easy access to online bank and credit card accounts and around-the-clock lending sites increase the likelihood of impulse betting and chasing losses. Even when online gambling sites have policies on restricting access, their ability to enforce them is unclear. Recovery from an online gambling addiction involves a strategy specifically tailored to the individual. A combination of treatments for a traditional gambling addiction and for internet addiction seems to work best. As a recovering online gambler addresses the thoughts and feelings behind the compulsion and builds healthier choices and a good support network, resisting urges becomes much easier. To learn more about online gambling, visit the Information Center at blakerecoverycenter.org or carrierclinic.org.
I hope you guys were all able to hear that. And let me see if I can. Derek, Corey, were you guys able to hear that?
Yep, it sounded great.
Okay, good. All right, great. So I think people are able to answer the question from the poll better now, right? From what we are able to see, from what we are able to tell, internet gambling affects mental health, affects health, and is probably going to be, if not already, more problematic than non-internet gambling, so gambling in a physical location. And so that was the answer to the question, in case anybody was wondering. All right, so how does internet gambling affect health? Like we're saying, or like he said, and I'm just, reiterating, increased self-isolation and mood disorders is something that we expect to see. And I think it makes sense in light of everything that has been happening with COVID for each and every one of us, right? We've been cooped up, we've been restricted from other people and things like that. But people who maybe were already doing this or then begin to do this, get engaged more and more, and it increases their self-isolation. They want to do it all the time. They're obsessed with making sure they know the numbers and they know, the sports, for example, or what's going on. And they tend to then start to withdraw. And so we expect an increase in mood disorders as well. Everything from anxiety, to depression. I mean, anything that you can think of. Then increase poor physical health. And one suggestion that is coming into play or coming into light, and something that maybe we don't always talk about when it comes to gambling is, how does this affect the person with a physical disability? The presence of online gambling then, and the increase in it then suggests that it might be that people with a physical disability have more, I don't want to say more access, but they are able to better engage, as opposed to maybe some of the problems that they would have had having to go into the casinos. And so that's one trend. I just put it right there for people to think about and look at. If you have people in your population who have a physical disability, I wonder if we're asking them the question about their internet gambling use. You may think, well, they don't go to the casinos, but what are they doing online? And so in general, again, increased poor physical health, people aren't sleeping. So again, and sleep deprivation is linked to so many diseases. And so that's a very important thing. We believe that when minors are involved in internet gambling, they're in particularly susceptible period of developing addictive behaviors or other mental health disorders. And again, realizing that this is something that we are not able to see. You might see them on their computer and it looks like they're watching a game, but does that game have some kind of, or playing a game, I should say, does that game have some kind of gambling related element to it? A lot of people are not paying attention. And so it's important to know what our minors are doing, because we understand that our brains are not fully formed until we get into that 21 to 25 age. And the younger we are, the younger we engage in behaviors that are harmful for us, the harder the road to recovery is. But there is recovery, and that's the good news. Participation in live action sports betting, also known as in-play. Again, if you listen to Dan earlier, I'm sure he explained this particularly, we believe is an independent predictor of internet problem gambling severity. So how strong is the word? How excessive the individual's internet problem gambling is we believe directly related to how much they participate in live action sports betting. You have to realize this is wanting to know minute by minute what the play is, and all of this adversely can affect how much engaged they are in gambling, and how severely they could develop an internet problem gambling. Okay. All right. And so what is the relationship between gambling and mental health? We believe that individuals with gambling disorder have been found to be 30 times more likely to have multiple, and that is 3 or more, other lifetime psychiatric disorders compared to those without a gambling disorder. And so again, anything from being bipolar, being, having anxiety, all of that. We're saying those with a gambling disorder have been found to be 30 times more likely to have 3 other of these diseases compared to those without a gambling disorder. And that's huge. That's definitely a compounding interest, for lack of a better term, for the person who's already going through something, or as a result of their gambling problem begins to develop some of these other diseases. Because what we understand so far is that 74% of this comorbidity precedes and may be a risk factor for the development of a gambling disorder, rather than a gambling disorder serving as a risk factor for the development of other psychiatric disorders. So again, in layman's terms, we believe that 74% of people with some kind of a mental health issue or a disease are likely to develop a gambling disorder. 74% of those people are likely to develop a gambling disorder than the other way around. Whatever the case is, there's an association. So those who start with having a gambling disorder, it could also be then that they develop these other diseases. But as of right now, we definitely believe that some of these comorbidities, 74%, serve as a risk factor, and that's important to put in mind, again, within the populations that we're working with. Similarly, we say gambling is associated with mental health disorders, sometimes as the cause and other times as the result of an untreated mental health disorder. So sometimes some people are not aware of what that mental health disorder is, and it might just be the gambling disorder that has revealed itself. And so then there's some association, and we don't know whether, and maybe, after realization, we don't know whether it was the gambling that caused the mental health disorder or it was the untreated, because it hadn't been treated, mental health disorder that caused the gambling disorder. And researchers have suggested that one of the precursors of behavioral addiction is the presence of mental health disorders such as depression, substance dependence or withdrawal, and social anxiety. So remember that, gambling was at one point considered a behavioral addiction and not, what's it called? Not a addiction like it was substance abuse or drugs. And so the research then believes that some of these other mental health disorders serve as a precursor for behavioral addiction, such as gambling, such as food addiction and things like that. And some of the most common mental health disorders associated with gambling include depression, anxiety, bipolar disorder, mood disorder, antisocial personality disorder. I'm sure you guys all know this. And two other prevalent issues that might be connected to the gambler's mental status: domestic violence and suicide. So again, just trying to put a full picture of saying internet gambling is what we believe is getting worse or has been worsened by COVID-19. Internet gambling adversely affects mental health, and we believe it's adversely affecting mental health more than that which has, which we see in people who were only constrained to physical locations, and a deep understanding of the fact that there's mental health issues related to gambling means that internet gambling is something that we need to really focus on, is something we need to make sure that we are treating somewhat uniquely than those who are just going to participate in physical locations, especially when we're saying that those who oftentimes have this disorder and are now, and now dealing with this as a problem, are going to not only going to go to physical locations, they're also going to participate in internet gambling. Okay, so research is yet to answer the question, like I said, does a gambler participate in internet gambling because he or she already is a problematic gambler, or is online gambling what causes the gambling related disorder? So again, because we've not been able to kind of differentiate between the idea that there is one that is going on within the physical location versus internet, we're not able to answer this question as to what is preceding what. So is it highly possible that I could only be an internet gambler, do nothing else, and then become a problematic gambler or not? We're still not sure. And studies have found that internet gambling is positively correlated with the development of gambling-related disorders, and therefore it is reasonable to conclude that mental health is a major risk factor in an internet gambler experiencing a gambling disorder. So I'm just trying to put this in our heads again, saying the same things, but trying to have us really understand the association. Additionally, again, something I've said, online gamblers are more likely to be engaged in a greater number of gambling activities, and the greater the level of involvement, the greater the potential losses sustained, and the greater the emotional distress and mental health issues experienced. Now, a big part of what is happening, and I would like to ask a question, even though I did not put it on there, and maybe you can just say in the chat or by raising your hands, can any of you recall unprompted at least one gambling brand or one gambling advertisement you've seen? And I guess maybe through hands or in the chat. Trying to see if I can get the chats. Is anyone there? Sportsbook. Somebody said sportsbook. Okay. Anybody else? No? Oh, Ohio Lottery, Bentley. Okay. FanDuel. Okay. Billboard. Hard Rock, TV ad with artists painting scratch off. I haven't seen that one. That's a good one. Okay, so unprompted, and I asked the question to say that if you didn't see it prior to COVID-19, since COVID-19, the advertisement has gone bananas, and I hope I can use that word. It has been insane. The one that comes to my mind now is the recent one with Jamie Foxx with the MGM, I think, casino. I mean, it's a beautiful ad, but you know, it's the world we're living in now. Almost every advertisement you see is, lately, at least for me, has been gambling related. It's interesting. I'm in Nigeria, and it's the same thing. And you realize that this is a real big impact into why there's maybe even the increased association with internet gambling, because that's the offer, right? Now we know that COVID-19, people are no longer maybe even wanting to go you know, to casinos. And that was something else I forgot to mention. Think about people who have social anxiety disorders, right? And so now there's the medium to be able to do it. There were some people who had, you know, maybe even things like OCD, where you would be worried about going to physical locations, and now there's this stream of there's this platform that allows you to be able to stay home and deal with your social anxiety in the comfort of your home and still engage in these activities. Anyways, I digress. So what is the impact of this gambling advertising we're seeing everywhere constantly? The first thing to kind of note is that most of the environments in which participants reported seeing or hearing betting advertisements were not in environments specifically designed for betting. So think about it. You are maybe at a music concert and you see an advertisement for betting. You at I mean, the rate at which we're seeing it everywhere, it could be anywhere. So it's not like it was back in the days when maybe the focus would have been on your way to Atlantic City, right? That's where you would have seen it, or wherever these casinos are. You would have seen the big signs. You would have seen all of that. It's not on. These are not buses that are maybe going to the casino and things like that, or the train going to the casino. None of that. It's not by the physical location of a lottery stand or something like that. Now you're seeing it any and everywhere. You could be watching Lion King or one of these children movies, and the ad that comes up afterwards is a betting ad. So that's one thing to kind of point out. You know, now that I think about it, I don't remember seeing gambling ads, betting ads, in the movie theaters. I mean, prior to COVID-19, I actually don't remember. It's possible, but I actually don't remember. So again, think about the fact that the environment is now then changing as to where people are seeing or hearing about these ads and the impact that can possibly have. And studies have shown that individuals with a gambling disorder are disproportionately influenced by gambling marketing. That's why I asked the question, how many of you can go on recall? Because again, now it's become so much more of our lifestyle or you know, what we're used to, that people can make that association. They can think, I need money. I remember seeing that MGM ad, and I believe they're offering $100 for $1, something like that, something like that. So I mean, it makes sense. I need a quick buck, right? And of course, the advertising typically depicts gambling as exciting, glamorous, and skillful, promising easy financial and social rewards. So again, just put it in context of what that can do to someone who, especially with COVID-19, where people were maybe losing their jobs and things like that, how that maybe could have influenced or could influence their willingness to participate or engage in online gambling. Youth and problem gamblers appear to be easily influenced by gambling advertising. Again, think about how glamorous it is. The one I remember, for example, is using Jamie Foxx. He's an excellent actor, he's an excellent musician. I kind of want to relate to that. And that's anybody that has taken anything on advertising, we talk about the trust factor that we have when we use a celebrity or someone people like, someone people trust, things like that. So if Jamie Foxx is telling me that I should go create a betting account, why wouldn't I do that? Especially for a young person or for someone who's a problem gambler, who's easily influenced by things like this. Of course, the bonus offers for sports betting appear to particularly increase internet gambling among problem gamblers. Again, the association I was saying about, I think $1 or as little as $1 got you $100 in rewards, something like that. There's many of these offers, and it can sometimes, it's smart thinking. It's kind of the same way casinos would do it when they would send you something and say $20 dinner on us, or a free dinner on us, or free hotel stay on us, right? It's just, we just took it to the internet. But they've somehow been able to use some of these things smarter, quicker, with internet gambling that lures people in, and among problem gamblers, we're seeing that increase. Now, there is some research that says, and again, we're going to have to see what this is now after COVID-19. Remember, this was, prior to COVID-19, this particular research, which it said, gambling advertising to date has not been found to motivate many people to commence gambling. However, it can increase gambling among existing gamblers, and that it also reinforces inaccurate beliefs about gambling and normalizes betting. This study was done prior to COVID-19. I want to say that I can bet money, but we're not supposed to be gambling. We're supposed to gamble responsibly, I should say. So I don't know that that's gambling responsibly, but I can almost, assume that this is different now, after COVID-19. And so just to continue on that trend, one of the things that the research had seen was that inducements were also linked with feelings of greater control over betting outcomes, and stimulated some individuals to sign up with more than one betting providers. Again, so when you say things like as easy as $1 to join and things like that, it gives you a greater feeling of control. It makes you feel like, well, if I lose $1, what's the big deal? The big deal is you have that, and you create 5 accounts with 5 different betting providers. You put in your $1 with every one of them. You win with all of them because that's the initial draw. And then that hooks you in enough to want to do it again and again, and eventually, become a problem gambler. Gamblers report influence from promotions in the form of increased gambling involvement, reduced perception of risk, and increased impulsive betting. Again, this is the understanding that these are people who were already gambling, were already problem gamblers, and they're reporting that these promotions influence their involvement with gambling, it reduces the perception of risk and increases impulsive betting for them. An online survey of internet gamblers found that compared to all other gamblers, problem gamblers were significantly more likely to gamble online because of advertising. So again, the trend had been that it was among those who identified as problem gamblers. It'll be interesting to see if the study recreates that test, what has happened after COVID-19. In one study, treatment-seeking gamblers reported that promotional marketing triggered gambling sessions and undermined efforts to reduce or stop gambling. Again, when we talk about gambling, we say one of the things I would always say was, you can't necessarily run away from money, right? We need money for everything else that we need to live, right? And so that's an easy trigger, and advertisements kind of do the same thing with the inducements, with the promotions, in making it seem so easy, and the fact that now it's literally every time you watch something, every time you are on the TV, listening to the radio, some gambling advertisement is coming up. It can, for people who are actually already then seeking help for this, continue to trigger them and undermine their efforts to reduce or stop gambling. And promotions were further reported to lead to longer gambling sessions through increased availability of gambling funds. So again, think about the person who, maybe you're already a problem gambler and you quickly sign up with a new account with the $1 inducement or promotion, because you're going to get $100 real quick, and then continue that session. And so you can quickly do that. And so imagine how many people are able to have multiple accounts. I mean, think about how many of us have different emails for different things. I could use all my emails to create a Netflix account and never pay for Netflix or never pay for any of these TV things, because I'm able to use it for 7 days with that account. I'm able to use it for 7 days with that account. I'm able to use it for 7 days with that account. I could pretty much watch a whole season of something I wanted to watch because I'm able to do that with different emails. That's kind of the same idea that this does for someone who's gambling. And so then, what is help? How can we help them? What are some strategies that we can possibly induce or put out there to reduce this harm? And these have to be online strategies. Remember that at this point, we're not able to see people, we're not able to meet with people physically. What are some online strategies that we can put? The first thing I'm stating here is some kind of a limit setting. Now, whether it's these companies that put it into their system, right? Or whether it's for the individual. So a suggestion will be for an MGM Grand or one of these organizations to put some kind of a limit for people. Maybe they have to consent to it, but as you're setting up your accounts, for example, you can say, I set a limit, of once a week, or this amount of time per day. The same thing with money. They can help by putting it into their system to encourage people to sign up for a loss limit, right? If I lose $100, I can't play again. Deposit limit, I can only put $100 a day, or restricting access to money. I can't automatically take out from my bank. Now, again, whether it's the organization, whether it's the individual, these are some strategies. Timeouts, right? Put in some kind of a system that maybe kicks people out after a certain time. Again, using their consent, right? Using their consent about putting some kind of a restriction on themselves. Or again, making that option available so the individual themselves can put that restriction on themselves. So for example, nowadays the phones, the Instagrams, the iPads, they have such a thing where you can say, I want to log out of, I only want to spend 1 hour in this app, and it automatically kicks you off after that. Of course, it also then tells me once it's time that, oh, do you want to extend your time? Do you want to extend your time by 15 minutes, or do you want to end? So again, still giving me the option, but that's some way that not just the individual, but the organizations can also help. And I've never participated in online betting, so it is possible that there is this, but again, this is just also for those who, as you're talking to people, enlightening them about some of these options. An on-screen clock, for example, having some kind of a clock on your screen as you're betting all day that lets you know you spent 11 hours doing this all day. That might be helpful. Age verification check is very, very important. As you saw in our study, it was younger people that were gambling and starting to gamble, and it's the same thing that we're seeing so far around everything internet gambling. Again, makes sense events. This is the internet world. I remember not having a phone growing up. I don't think there's any kid now that doesn't have access to a phone or iPad or some kind of a device. And so they're starting early. And so we, we want to make sure that as policies, these are some of the conversations that need to be had around internet gambling, even around internet gaming. Is there some kind of age verification check to make sure that people who are too young to do certain things are not doing it? A suggestion is a brief intervention, maybe like the brief biosocial gambling screening question or messaging on responsible gambling as pop-ups. Now, you have to understand, I'm coming from a public health perspective, so I hope I'm not offending anyone by saying some of these things, but I think these are important things that we can put in place, or we can ask people, the people that be, to put in place that can save someone's life, right? So the brief 3 questionnaire that pops up once you've noticed that someone has been playing for 48 hours straight. Or a brief messaging or constant messaging, maybe, that comes up as a pop-up, the same way we see ads constantly that come up as a pop-up to encourage responsible gambling. Personalized feedback on individual gambling behavior. Again, I use my iPad as an example. It tells me this is how much time I spent on my iPad weekly. Some kind of feedback that the person is able to see on their phones, on their devices, that then tells them, this is how much you have spent, this is how much time you have spent, this is, your gambling activity increased 20% this week. Some kind of thing, because again, when I'm thinking about the public health model, these are some kind of self-efficacy stages of change theory models. I mean, I can think of all the models that some kind of self-actualization that can help someone instantly recognize their problem and be able to take some kind of action. Changing the parameters of the rewards and loyalty points. Again, that's something that might be outside of the individual's control, that might help them. Restricting advertising as much as possible, right? Again, I'm not sure who's controlling what nowadays, but if we're seeing advertising going on after a child's TV show or things like that, however way that it can be restricted to ensure that younger people are not being affected, especially. And as we're seeing now with COVID-19, the influence of telehealth, online therapy should become a really big deal around gambling problems, right? These people are already used to their internet. They already have a good relationship with their devices. It is very possible that then they're able to immediately access this help, and that might be enough to help them in that moment when they want to engage in gambling. They're able to quickly access some kind of a online therapy that is able to help them, kind of like how in substance use we would say they have a sponsor, but having an online version of that. And so this is my next poll.
And the poll should be up. And if you cannot see the poll, make sure your Zoom is not in full screen. But feel free to take a moment and engage with this poll. And Olu, if you just want to tell me whenever you want me to close it out, I will do so.
Sure. Corey, how much time do I have?
About 9 minutes until we pop into Q&A. But if you want to take an extra few, then that's okay. Fair. Cut Q&A to about. Thank you.
All right, real quick, just in case anybody can't see it, which of these online strategies to reduce harm do you think is the most effective? Limit setting, the money limits, timeouts, on-screen clocks, self-exclusion, age verification checks, the brief intervention, the personalized feedback. Yeah, that was the last one. Since I don't have time, I will close it. This was just me curious to know what people think. Okay, so people think the loss limits, 33% of people think the loss limit is a good one. 23% think the limit setting is a good one. And the personalized feedback is 14%, and somebody said self-exclusion, so I'm guessing that was an added thing. And so that's good, that's great. I was curious. I personally like the personalized feedback. I think it can be really done, if it can be really done effectively or smartly, I should say, it could be very effective. So interesting to see what people think about that. All right, so I don't have much, I believe. I just quickly wanted to, again, giving you an overview of how I, as a public health person, and all of the people in public health are thinking about, the approaches to addressing gambling-related harm. And one of the things I can tell you is that we must integrate gambling prevention efforts with existing and best promising practices that we already see in things like substance abuse prevention, for example. And the other thing I'm going to say in addition is, we have to think about this as something that is most likely going to affect even non-gamblers in some way, or people who even want to do it for the first time. And we say that because we want to ensure that even people who, or especially younger people, are cautioned to begin gambling in of itself, so that they don't get to the harms that come in. So, for example, we talk about price and taxation regulation. That might affect more the casinos, for example, but it's important in some ways, if there's some kind of taxation that comes to them, that reduces the possibility of somebody being harmed. Again, we said minimum bet allowances, especially for internet gambling. Again, that this might be things that definitely affects the companies, the organizations more than the individuals, but as a collective, it's just things we put into play that can prevent harm. Taxation on wins for land-based venues. Of course, the caution here is that this might increase illegal gambling. But again, we kind of have to, one, test it out, take the good and the bad, but also that's another piece of control that, the government, for example, has control of that, being able to make sure that there's not a lot of ways that one can participate in illegal gambling. Regulating gambling content, regulating packaging and labeling around any products that have to do with gambling. Of course, education, communication, training, public awareness, for example, what we're doing here today. The ways we can control advertising, promotion, and sponsorship around gambling, around anything with betting. Again, demanding some reduction measures as far as how we are working with, the governments, these organizations, to ensure that people don't develop this problem. Regulating accessibility, making sure, again, online or in person, we are doing everything to prevent illegal gambling, making sure that people who are doing this are not, below the ages of 18 or 21, depending on where, those kind of things. And of course, continued research, surveillance, and exchange of information. Like I've said, everything has changed now since COVID-19. And so we need more data, we need more information, we need more understanding of what is going on. A lot of times you heard me say, this is what we think, this is what we know. We need the DSM-5 to come up with some kind of, updated information around internet gambling and things like that. How is this related to internet gaming? How is this related to land casinos? We need to understand how this really affects. We've always kind of assumed that males do this more than females, what's happening now, the gender, all of that. For me, that's a really big thing that I think we in the gambling world are lacking. And it also means that we need more support. We need more support from the government, from the casinos. I would suspect that they would want to know this information, what, sports betting companies and all of that, because it also makes them better understand, some of the maybe liabilities and issues that they have to deal with around people who have problem gambling and things like that. So, again, not all of this is focused on the individual. It's more of a collective issue. But for example, when we said when as public health we came up, or it dawned on someone somewhere that did research and found out that we needed to wash hands, putting it as a policy for every doctor, for example, to wash their hands before they started treating someone, wasn't good for one person. And the doctor himself may have been, annoyed because they quickly have to run from one surgery to the other, and they may not have thought about it as time, or not having the time, but the impact is felt, especially years later, but more importantly in the lives saved eventually because of putting in little measures like this. So that's just one random example, but my point just being that some of these things may be hard to implement or to consider now, but it has long-term ripple effect is what we believe. And lastly, just to again put this whole framework around what are we trying to do? What are the goals when we say we want a public health approach? We're trying to denormalize, right? We're trying to prevent, we're trying to protect, and in some cases, we're trying to reduce harm. How do we do this? We do health education, especially for denormalizing the stigma that can come with this. Health communication around prevention, community development, and policy development. So, like some of the policies I was suggesting in the prior slide, towards protection. And then organizational development to reduce harm. And there's many things we can talk about, even around maybe what are companies doing, right? Companies can sometimes do screenings around blood, around substance use. What are they doing around gambling? What are they doing around, what are schools doing around gambling? There's so many ways that as communities, as organizations, we can get involved to prevent, protect, and reduce harm for individuals who are affected with gambling. And of course, as you can see, all of this is is across the spectrum of intra or interpersonal level, the community level, the policy level, the institutional level. All of this levels of development, organization, or whatever, is necessary for us to be able to achieve our goals. And so, lastly, in what are some of the health promotion action areas that we are taking towards helping people with gambling problems, or reducing it, or preventing it, or protecting it? They include developing personal skills. That's why we talk to people as far as young as middle school, right? Strengthen the community capacity, right? Hoping that in some ways a strong community isn't too lured by some of these engagements with land-based games and things like that, but now starting to think about how do we strengthen our online community capacity? How are we making sure that we're creating supportive environments for people that are sitting down at home? Of course, building healthy public policy is going to be very big. It's probably a major part of what we're going to need to push through, as public health professionals, to ensure that we're helping people, we're preventing, protecting, reducing harm for people. And lastly, especially since this is Gambling Disorder Month, and I think Screening Day passed a few days ago, we are renting health services. It is important that health services begin to understand that they need to be screening, they need to be asking the questions, they need to be involved in providing solutions towards gambling problem. Someone comes and maybe they're complaining about insomnia or migraine or some kind of, health thing that might seem very normal to people, but really might be because the person has been gambling on the internet for 48 hours straight. And we're not asking those questions, and in fact we may even assume it's alcohol or drugs or something like that. And health services in particular are one of the organizations that need to be really reoriented and really start to think or be aware of the part that they play in, again, prevention, protection, and harm reduction around gambling problems. And so I think I have one last question. And this is just to see if people were listening. Is mental health disorder the biggest risk factor for problem gambling, true or false?
And this is going to serve as our knowledge check poll question. If you've been on previous webinars during the conference, this is kind of the one that we do right before we move to Q&A. So go ahead and take a moment to respond to this poll just to verify attendance. Again, if you cannot see the question, it may be behind your Zoom window, so please move out of full screen mode. I also have put the question in the chat as well, so you can engage in the chat. I will go ahead and pass it over to Mike Bazzelli, who will facilitate our Q&A.
Thanks, Olu. That was really great information and timely, considering the topic. And I've been getting those questions. I know Derek has, and Corey, and probably anybody doing trainings over the past year. The simple question of, are people gambling more? Are people gambling online more? And we can assume and we can tend based off of other information we've been given, like calls into helplines and stuff like that. But to look at that data straight from online gambling during COVID is really interesting and going to help us answer some of those questions. Some of my initial thoughts, I thought your, metaphor about doctors washing their hands was really great. It kind of probably seemed unorthodox. Like, why do I have to always wash my hands back then? It seemed like that way. But you mentioned the greater impact it had on everyone because that became a practice. But I think you could even take it a step further and say, it became second nature. A doctor couldn't imagine not washing their hands right now or not using sterilized tools. They couldn't even imagine that. So I think that can be, then mirrored to responsible gambling programs and policies that, maybe some companies do as little as possible because they don't want to do it. Some do a really good job, some go above and beyond. But if we can make it where it becomes second nature, that thinking about the health or the safety of the consumer of their products is second nature and something that they shouldn't, have to always think about because it just comes naturally, that would be really great.
Absolutely.
Another thing that, got my attention when you were talking about the Jamie Foxx ad and how that resonated with you. That brought me back to when DraftKings and FanDuel really came out, maybe it was really big 7 years ago, I think here. I remember one ad that really spoke to a lot of people in my generation, young males in their mid-20s. The ad had, a guy in a football jersey with a backwards hat. And those ads just really spoke to, I think, people who were engaging in DraftKings and FanDuel early on to say, that could be me. Like, that guy looks exactly like me. It was opposite of your classic, casino ads where a guy in an Armani suit with an expensive watch, throwing dice on a craps table or something, looking at a guy with a backwards hat and sunglasses. It was a lot of people were like, that could be me. I could do this. So I think that's why a lot of people got involved in that. And you were talking about the power of marketing and advertising and that getting folks into the action of it. I have a question from Claire here, and there's some more coming in. And if you did touch on this and I missed it, I apologize. But is there research on the different types of online gambling when it comes to risk so like blackjack versus slot machines, bingo, other games of risk, or are they all kind of lumped together as any gambling online that is of major concern?
I don't have all of the data in my head, but I will point out two things that I definitely have heard, whether, in the organization or something I've read. Slot machines, the same online as it is in person. And then sports betting in play, that I made mention of that because that's where the engagement is. So it's not just sports betting, like I go to a bookie at the casino or at the, I don't know, wherever, and say I'm picking Jets versus Patriots, which will end in disaster. But the in play activity of that, as far as an online engagement, is two big things I've heard that is problematic.
Mm-hmm. Yeah, and Lynn chatted in here, if older Americans were more familiar with internet gambling and gaming, the stats for potential addiction could escalate, and I think that's true. And maybe we'll see that over time as more and more folks.
Well, I forgot to mention that, but it was 54 to 64% when 19% of the people were 54 to 64%.
Yeah, so that's a pretty large number.
54 to 64 years old. I'm sorry, I keep saying the same thing. 19% were 55 to 64 years old. That's still relatively, I mean, again, it was a small sample size, but that's still not a bad number.
Yeah, so, and that, that population probably is becoming, I'm just speculating, but more and more comfortable with the use of phones and electronics because, I mean, it's how we operate now in today's world.
Right.
So,
right. And we're teaching them, right? So, my mom will say, oh, come and tell me how to do this on the phone, or come and show me how to do this on the phone. You teach them once, they get it, right? And so, and then think about how, because sometimes I think when we think about online betting, we're thinking about some of the bigger games, or we're thinking about some of these, like a sports betting kind of game. But think about the slot machines games. They're easy, they're simple, they don't require a lot of smarts or things like that. And so word games that have some kind of gambling related kind of activity, and you're probably gonna see a lot more of that, especially in countries like Nigeria, for example. I know that some of the people I've spoken to, those are kind of some of the games they're thinking about because it's easy and you can do it without thinking. And, smartphones are everywhere nowadays.
Mm-hmm. Great. Well, I just wanted to let you know about all the chats that are coming in if you're looking at them, but just a lot of excellent presentation, great information, very enlightening. So I think a lot of people got a lot out of this. And again, like I said, we keep getting the questions of it simply stated as, are people gambling more? And sometimes it's hard to answer that without the numbers. But again, I said we can speculate, and we here in Ohio, we get anywhere between 400 and 500 calls to the helpline every month. And during the peak of COVID, those summer months, we were getting almost 250 more calls per month. So, we always kind of cite that as one of our numbers. But again, to see these numbers of the online gambling, which of course was the option that everyone was going to, is really great. So thank you again for joining us.
Thank you.
Nigeria, and I wish you a safe trip back to New Jersey when you do make that trip, and hope to talk to you soon. But I'm going to turn it back over to Derek and Corey to kind of close out for the day.